Well, I'm Dr. Vasant Kumar Gaurani, and today just I want to explain you about the Omicron variants, origin, signs, symptoms, pathophysiology, investigations, complications, and medicines. Remember, this one is going to be the first ever treatment. Shows that in 4 to 5 days the patient will become negative with these drugs. How it is going to be, I just want to explain it to you in a clear way and proper way with all the slides. Please follow all the slides till end and please subscribe. We all know the origin and the structure and everything. The main virus which has been there, that is an alpha, beta, and delta, which has been having the devastating effect on the lungs, lung parenchyma, and the blood vessels too. And moreover, the world was looking after only the lungs, but the coagulation pathway is also affected in this COVID. I already explained in one of my video in January, and just go through it in clearly. It says that how it is way. Now I want to explain it in a clear proper way regarding the Omicron. It is South Africa 24 November 2021 named as an Omicron variant, B1. At the time it is a B1.1.529, and the other variants which are the BA2, BA275, BA4, and BA5. Now BA5 is one of the predominant in US and UK and other countries, but in India, whereas BA2.75, which is looking something different than other thing by holding some of the I can say mutations along with the delta. I have seen the lung infection too in this BA2.75, and this can be one of the problematic one. I can say that the new variants has more mutations at various places. The Omicron is said to have the lesser penetration to the lungs than the delta. That is quite clear in the last 2 years. But as far as the pathophysiology is concerned, this is affecting the clotting mechanism. This is one we had to see the clotting mechanism. It is observed in 3 cases with increased D-dimer level. There is a fall in SpO2 level to 80%. HRCT, there is no involvement of the lung. Well, I have seen so many cases for D-dimer levels, and I just prepared this slide at the time. Well, the symptoms, signs and symptoms. Well, fatigue is one of the things. Body aches, cough, running nose, headache, low-grade fever to high-grade fever. Usually it's 1 day or 2 days, but the fever is there, and the periorbital pain, diarrhea, and scratchy throat. When we see all these things, this is the symptoms that has been there in the COVID patients, mild to moderate, and some people some people had the cough for a long time too. Well, most of the incubation period said by some of the articles published in the various journals, that shows that the infectivity is 8 to 9 days in so many articles, and this infectivity has any of these drugs which has been right now, except the Paxlovid, which is saying 6 days, but any of the drugs did not say that it will be negative by the end of 4th or 5th day. But this treatment protocol is going to say 4th or 5th day is going to be the negative. Well, spreading of Omicron is faster than the Delta. In Omicron, only the clotting mechanism is involved and the lung is in lesser extent. In Delta, both clotting and the lung damage is there. The virus replicating in the upper respiratory tract and not extending to the lung. So the lung involvement is less in Omicron. But the thrombus, the thrombus or the clotting mechanism, which has been there in the lungs, will decrease the saturation. But patient will be quite comfortable because of the oxygen intake and sparing of the lung parenchyma. The Omicron variant mainly affect the clotting mechanism, due to which there is a fall in saturation of SpO2. That is what I think. Well, this is the typical cell, how the virus enters into the cell and replication in the rough endoplasmic reticulum, and from there it goes to the Golgi complex to form the the virus particle, from where it goes out of the cell. And some of the virus, here the one important thing why I want to say here is, some of the virus will enter into the blood vessel and damage to the endothelial cells. That is what the ACE receptors. Where are these ACE receptors? Basically, I want to say here itself, basically the heart muscle, heart, that is what heart, lungs, renal parenchyma, kidneys, spleen, liver, intestine, stomach, and the brain. Well, almost all the organs, it's there. Because of that, the clotting things that happens at that place, at that organ, will create the problem, and decreases the efficacy of, decreases the whatever the functions of the organ there, and causing the problem. Well, this is one more slide, and the clot formation. Because of that one, I want to make it clear in this one. And these clots which are formed like a thrombus, if these clots are dislodged after some time, that causes a big problem to the patients. That is why most of the strokes nowadays with mesenteric ischemia, so a number of cases are coming out, and deep vein thrombosis. These all things are there. Well, investigations for the Omicron. That is a test, RT-PCR, rapid antigen test. Well, CBP platelets are been the lower limit. That is 1 lakh to 1 lakh 20,000, 1 lakh 50,000, 1 lakh 80,000, and D-dimer level may increase. D-dimer level has been increased in the patients who are been already having some heart problems or the liver problems, mainly the fatty liver. The C-reactive protein increases. We know all the things. We all know most of the RNA virus causing the myocarditis. This is the basic principle that has been there. Most of the RNA virus causing the myocarditis, pericarditis, and in the Delta variant we have seen myocarditis and pericarditis. The localized inflammation in the upper respiratory tract along with the serratia peptidase may cause mucormycosis. Sorry, steroids. Causes the mucormycosis. Yeah, this is a localized inflammation. Really, it was a big problem in the Delta wave, where the steroids along with this inflammation, local inflammation, and the clot formation causes most of the mucormycosis in India. The rise in D-dimer indicates that there is a clotting in the body. Well, we all know that. The rise, if it is more than 500, then we can say that it is an indicator of clotting in the body. Always there will be an equilibrium maintained in the body, the clotting and the... If the clotting mechanism is not stopped with the anticoagulants and thrombolytic drugs, the coming days we may see the increase in the heart attacks and strokes with large clots. That is what most of the people today, these days, are dying with the heart attacks, strokes, and with a lot of problems. Much of the heart damage caused by the COVID-19 is believed to be the stem from small clots that blocks the tiny blood vessels, capillaries in the heart muscles. Well, one way the virus, RNA virus, which is the COVID-19 coronavirus, Omicron or Delta or any other virus, that directly attacking the cells of the muscles of the heart and causing the inflammation there, thereby with the vessels of the heart, which is also involved, and where the IC receptors are there, and that is going to be affected by the virus and causing these heart blocks and arrhythmias and all those things. Well, deep vein thrombosis is one of the most one of the commonest things, and other parts of the body affected, the stroke. The brain is involved here, and brain strokes are common nowadays. It has become a common thing after the Delta and Omicron cases. The lungs, liver, kidney, spleen, pancreas, thyroid, mesenteric, the intestine, causing the mesenteric ischemia, and trouble sleeping, muscles and joint pains. Well, mechanism of action of serosopeptidase and colchicine in SARS-2. The main two drugs, along with other drugs, plays an important role in the COVID-19. This is what I want to make it clear here. The main drugs are the serosopeptidase and colchicine. If the patient use these two drugs and have the good diet, they will become negative in 4 to 5 days. It's in all the cases, but I can say I can keep a question mark here in the any liver failure cases or fatty liver cases or cirrhosis of liver cases. It may take 1 or 2 days extra other than this. Well, serosopeptidase, colchicine, well, zinc, estate, vitamin D3 and multivitamins. These are the useful drugs in the treatment of the COVID in my protocol of treatment. Well, colchicine is an alkaloid extracted from the colchicine organelle with potent anti-inflammatory activity and anti-fibrotic activity used mainly in the gouty arthritis. This is one thing you have to know, that is anti-inflammatory. Everyone knows that. Anti-fibrotic is the thing is preventing the fibrosis of whether it is a heart muscle. That is why there is one other article showing that it prevents the myocarditis. That is why the word has been included here. The microtubule is the main component of the cellular process that involves the maintenance of the cell shape, size, intracellular movements of the organelles, cell migration, cell division, and ion regulation. This is what the microtubule is doing. Microtubule is a skeleton, cytoskeleton, and it's a main role here is very clear that colchicine makes a complex of microtubule and inhibit all this process. Cell shape is disturbed, size is disturbed, intracellular movement of the organelles are disturbed, cell migration is disturbed, cell division is disturbed, and ion regulation is disturbed. So the virus cannot utilize anything in this regard. Virus cannot survive after entering into the cell. That is why the 4th day it is going to be negative. Second day, I'll tell you in the later slides. Colchicine binds to tubulin and blocks the polymerization of the tubules. That is what blocking the mechanism. The colchicine binds to the tubulin and interfering with the polymerization of the tubules by forming the colchicine tubulin complex, interrupting the microtubular dynamics, decreasing the cell functions grossly. That is why the whole of the cells, all of the body comes to an halt, but the functioning for some days will happen. The single positive strand RNA virus, after entering into the cell, changes to single negative RNA strand as a standard RNA. As is structural and the functional changes in the cell, single negative strand RNA may not utilize the cellular proteins, ions, enzymes, and other essential proteins materials for the transcription and translocation. That is what I want to clearly say. Well, the dosage, the loading doses is most important here in the COVID, but I do follow this 0.5 mg 12th hourly for 10 days, mainly 5 days I will say that in this Omicron, but 10 days in the Delta variant. The maximum concentration level of collagen to attain in the body takes 24 to 48 hours. That is why within 24 hours, whatever the spike of fever was there in the patient will come to normal. At the end of 24 hours to 36 hours, patient feel relief. By the 48 hours, in 2 days, the viral load will come down. Viral load in the come down, and at the end of the third day, you will see that whole of the 10 to 20% of the virus will be there. But on the fourth day, the patient will be negative with RT-PCR or rapid test. The collagen is primarily eliminated by hepatobiliary secretion, and these are the diarrhea is the most common side effect, and we can ignore it as 23% because plenty of fluids and all those things the patient has to take, and need not to worry of this diarrhea what is being caused by the colchicine. The most important to avoid in these drugs when colchicine treatment is the statins. The statins should be stopped. Fenofibrate, gemfibrozil, or should be stopped. Cyclosporine, digoxin. These all to be stopped, and the grapes also should be stopped. That is what preventing treatment for the myocarditis. That is what we can stop these heart attacks and all those things. Well, the coagulation pathway is more important here in the regard. Serratiopeptidase is one of the drugs which has been used as an thrombolytic, anti-edematic, anticoagulant, caseolytic, fibrinolytic. Overall this mechanism, fibrinolytic and thrombolytic, is more important in this Omicron, where it's causing the clots all over the body. So these clots can be prevented, and when we started this medication, it has given the D-dimer level has come down to from 1500 plus to 500 and below that in 5 to 6 days. Well, anticoagulant, thrombolytic, fibrinolytic active. The serratiopeptide is useful in the coagulopathy, thrombosis complication. Higher fibrinogen and lower antithrombin levels were reported in patients with COVID-19, and associated with it has been identified the intravascular coagulation, a manifestation of viral coagulopathy following the arterial, venous, and microvascular thrombosis and endothelial damage. This is going to prevent at any cost. This is starts an action in 1 hour. Well, the dosage, the loading doses is most important here in the COVID, but I do follow this 0.5 mg 12th hourly for 10 days. Mainly 5 days I will say that in this Omicron, but 10 days in the Delta variant. The maximum concentration level of collagen to attain in the body takes 24 to 48 hours. That is why within 24 hours, whatever the spike of fever was there in the patient will come to normal. At the end of 24 hours to 36 hours, patient feel relief. By the 48 hours, in 2 days, the viral load will come down. Viral load in the come down, and at the end of the third day, you will see that whole of the 10 to 20% of the virus will be there. But on the fourth day, the patient will be negative with RT-PCR or rapid test. The collagen is primarily eliminated things. The fibrinolytic activity of the serratiopeptide is coupled with multiple properties: proteolytic, thrombolytic, antifibrinolytic, fibrotic, anti-inflammatory, anti-atherosclerotic, and antioxidant activity. Suggests its potential benefit in reducing the severity of vascular complications involving thrombosis of coagulopathy in COVID-19. Serratiopeptide is observed in the small intestine, and the blood level of serratiopeptide achieved in 1 hour. The daily dosage of 10 mg thrice daily for 24 days has decreased the inflammation and removed the clots, blood clots. In high risk cases, I will say, but the younger patients, I'll say it for 5 days. Pathophysiology of COVID-19, there is a huge decrease in protein C and protein S, which are the anticoagulants. Where these are the things which are anticoagulants, natural anticoagulants in the body, but decreases when there is a huge demand of protein loss by with the virus in the liver, C-reactive proteins and other proteins, exhaustion of the proteins, I can say that. Because of that, the protein C and protein S, there is a huge decrease. However, after some time, if the recovery from the COVID, the patient may recover all those things of protein C and protein S, but it takes time. The serine protease has the activity of dissolving the clots and the fragmentation of fibrin polymers into D-dimer. Hence, the hemostasis is preserved and the exchange of gases takes place alveolar capillary region in the lungs. Because when there is a huge clots formed in the lung, definitely there will be saturation fall. But the other part, which is in the lung parenchyma, which is paired in this Omicron, by this, though the oxygen being taken from the lung parenchyma could not reach to the heart and everything, so that the blood things, so that there is a fall in saturation. As serosopeptidase plays an important role in the coagulation pathway, and colchicine plays the role by destabilization of the cell with the microtubular dynamics and stops the further spreading of the infection. That is why I'm saying the first day, if you start with the results with the positive, then immediately if we start it, the action of the serosopeptidase starts in 1 hour, the action of the colchicine starts in 24 hours to 48 hours. With the loading dose starts in within 12 hours, it may be. But when you see this, after 24 hours, the fever spike will come down. By second day to third day, whole of the viral load will come to zero. At the end of the fourth day, the patient will become the negative. The both drugs are the powerful anti-inflammatory immune modulators, helps in decreasing the effects of cytokine storm that we have seen in the Delta. The both drugs decreases the hospitalization and prevent from the long COVID. This is one of the most important thing. Well, this is going to be the cheapest. Everyone, it is the cheapest in the world, I can say. Cheapest ever treatment. Till now, we have seen so many people spending on lakhs and crores, and really it was become as an economic crisis to the people. And 100% efficacy in this one, and complete COVID for the COVID-19 treatment with only just 45 rupees of Indian currency with serosopeptidase and colchicine. Only 45 rupees for 5 days treatment gives in 100% and prevent you from the COVID complications, the clots, the myocarditis and everything. The colchicine and serosopeptidase will be effectively works on the Omicron variant because pathophysiology is same for all the COVID-19 variants. That is why I'm making it as a common thing for all the things. I had treated the alpha, beta, delta, all of them. But whereas in alpha, beta and delta, the treatment protocol has to be continued for 15 to 16 days, maybe extended to 21 days with the serosopeptidase. But for the Omicron, which is mild, looks like a mild variant, but having the clotting mechanism in this one, where the clots are being the problematic here in this Omicron, that should be treated with serosopeptidase, and colchicine prevents the myocarditis, arrhythmias, pericarditis. That is why these two drugs are the drugs of choice for the COVID, and the wonder drugs, a Sanjeevani drugs, I can say that, because the results which has been given since from the starting of the COVID. Uh, it is the wonder drugs, I can say that. Thank you. Such a kind of treatment which is useful, which is cheap, which can make the people decrease their financial burden. And now the education system has become bad, and sitting at home with the online classes, and the economy is coming down, and the poorer countries still becoming the poorer, the richest is becoming the richest. But today I just want to make it clear that COVID is a simple coronavirus is can be treated with just for 45 rupees in 4 to 5 days. It's quite simple, and we can prevent, cure, and we can prevent it from the long COVID. I request all the people to subscribe and share, and for the next video I'm going to make it with the evidence to show you. Thank you. Thanks a lot. Thank you.